Hello everyone, welcome. I'm Dr. Sharif Al-Halim and today I'm going to talk about defense mechanisms, especially immature defenses. So, what are the defense mechanisms? Let's just get an idea. This is mainly an unconscious mental process, or you can say subconscious mental process. It is used to resolve our conflicts that are inside the mind, and it prevents the undesirable feelings of anxiety or depressions in some stress situation. So this is very important for everyone. Actually, all of us use the defense mechanisms in different times to help relieve our anxiety or depression in different type of situations. So those are the primary tools of the ego. So ego is the intermediate stage of the mind, which manages the conflicts between the demands of the id, which is the basic instinct, and restriction of the superego, which is the highest hierarchy of the mental system. And it helps to maintain the individual sense of safety, equilibrium, and self-esteem. So very important. And you can actually summarize the ego defenses by saying those are the self-sustaining reaction pattern to stressors, simply sustaining personal integrity to any situation. So there are two types of defense mechanisms. Some are immature and some are mature. So immature defense mechanisms are reactions which are not that up to the mark, which is a manifestation of childlike or disturbed behavior to a stressor. And there are some more mature defense mechanisms which are adaptive to a normal healthy adult life. So those are not childlike behavior or disturbed behavior. Those are very good response, proactive response to a stress situation. So let's just get a better idea of what I'm talking about right now. So defense mechanisms, first of all, they are unconscious, they change over time, and most importantly, they are adaptive. They are the system by which we cope. So we all use defense all the time. So when I'm lecturing in this video, you actually can project the ideas that I'm talking about here into your own life. So maybe in some day before you might have used some of those defense mechanisms. So actually most of those defense mechanisms are used by most of the people, so it might be common. Some of the defense mechanisms might be very familiar to you. So the immature defenses are a lot, and I'm not telling the names. Just you can see the names: acting out, denial, after projection, and then rationalization, splitting. So there are a lot of immature defenses. I'm not telling in the sequence. So first of the immature defenses is acting out. So acting out is a very common immature defenses. It's mainly used by the younger part of the society, especially the young childs. So those are massive emotional or behavioral outburst to cover an underlying feeling or idea which is seemingly unacceptable. So those are some impulsive behaviors, and those impulsive behaviors actually covers up the real emotion. And it can be differentiated from another defense mechanism which is called displacement, in that the emotion in acting out is actually covered up and not redirected to something else. And one of the common examples which is seen in kid is showing or throwing temper tantrums, and those are shown by an abandoned child to cover up the depression that he or she really feels. And one another acting out situation is whistling in the dark by someone who is actually doing it to hide the real underlying fear. And very importantly to know, for adolescent boys and girls, substance abuse, overeating, or getting into fights are very strong actions that cover up underlying feelings of vulnerability. Some common examples may be someone like who is depressed and steals a car. A depressed 14-year-old girl with no history of conduct disorder now has some sexual encounters with multiple partners after her parents' divorce. So after the divorce, she was very depressed. So to avoid the feelings of depression, to avoid or to actually cover it up, she's acting out in a way that she's engaging in impulsive behaviors to actually forget the depression of divorce. And this is actually commonly associated with juvenile delinquency, because the teenagers are the most emotionally vulnerable people, so they are very emotional, and that's why they might get into juvenile delinquency. And it is common in borderline and antisocial personality disorder. So in short, you can tell acting out is an effect or emotion which is covered up by excessive action or sensation. So you can actually remember this part: affect covered up by excessive action or sensation. Okay. So next, and one of the very important defense mechanism is denial. So denial is actually used by almost everyone in extreme situations. So denial is avoiding the awareness of some painful reality, and this person does not expect the parts of reality which the person finds unbearable, and he is not actually allowing the reality to penetrate through the walls of his consciousness. And it's a very common reaction with patients who are diagnosed with some very dangerous diseases like AIDS, or someone with a diagnosis of cancer. And common examples might be someone like a woman who ignores a breast lump for over 1 year, or someone who had a heart attack. A patient now insists on continuing his lifestyle as if nothing had happened. There are some more common examples, like a child who is abused insists that she has been treated well, so she is actually denying that abuse. And women might be preparing dinner for her husband, expecting him to come home, even though he died a month earlier. So she is denying the fact that her husband died. And very important to remember that it is often the first response to a bad news, such as the impending death of a loved one or oneself. So this is very important to know. So this is a common reaction pattern to bad news, very important. And those are associated with substance abuse disorder. And the people who have used a substance for a long time are often in denial, claiming that are not addicted, do not have any problem in the face of clearly dysfunctional or dangerous behaviors. So dysfunctional denial is something like that, saying it is not so. So no, it's not true. I don't believe it. I don't believe it. It can be true. Though it's true, he or she doesn't believe that it's true. Okay, that's denial. Next is displacement. So displacement is also very common, used by everyone. And in case of displacement, you transfer avoided ideas or feelings to a neutral person or object. So someone you may have anger to someone, but you cannot show that anger to that person. So you show the anger to another person to whom you can actually show the anger. So you are actually changing the target of an emotion or drive, and you are having the same type of emotions all the time, but you are changing the target of the emotions. So some common example may be mother yells at her child because her husband yelled at her. So here mother is the subject who had the bad emotion, the anger, and she actually had the anger against her husband because her husband yelled at her. And now she is afraid, or she does not want to yell at her husband. Rather, she yells at her child because it's easier. It's a neutral target, or it's more vulnerable target, her child. A man who is angry at his boss kicks his dog. A dog is here a vulnerable target. Boss is someone who is not acceptable to be showing anger. So the man actually cannot show his anger to boss because it's likely to cost him his job. So that's why he's showing the anger to some neutral substance, neutral objects like dogs. A surgeon with unacknowledged anger towards his sister now is abrasive to the female residents on his service. There are some more examples here to actually clear you up the ideas. Suppose someone is angry at his boss. Now he pounds on the desk rather than telling his boss what really he thinks. So that's also, he's transferring the emotions which are actually towards his boss. Now he is showing the emotion to the desk, because desk can't do anything to him. An attending physician might scold a resident who later express his anger by yelling at a medical student, because a resident cannot yell at attending physician. So whom he or she can yell at? He or she can yell at medical student. So this is an easy target. So in displacement, we actually change the target from a hard target. We actually drive, or we actually bypass the emotion to target a easy target. A married man who is sexually aroused by women he meets, goes home and makes love to his wife. So he was aroused again to that woman he met. Now he had the arousal, but he's targeting the arousal, or he's showing the emotions to another person which is socially acceptable. Displacement often rounds downhill from a harder to a lower power hierarchy, and this is sometimes associated with phobias. And in one sentence, you can say the source says the same, but the target changes from tough to easy. This is all about displacement. So this concludes the first lecture on defense mechanisms. Thanks all for watching my video, and I hope I can make some more about defense mechanisms. Ta-ta.